We created the Dizzy Clinics Australia because we know that approximately a third of people over the age of 50 will suffer from vertigo and dizziness at some point in their life. And it's really important to note that although you may be suffering from these symptoms, it is completely fixable and manageable, and no one should ever live with dizziness.
Dizzy Clinics is a collection of different clinics throughout the country. And basically we're targeting dizzy patients of all kinds, so whether it's vertigo or vestibular, and finding ways to help them as best we can.
We treat all types of vestibular conditions, including vertigo, BPPV, vestibular migraines, vestibular hypofunction, Meniere's disease, and any other vestibular condition.
The benefit of having longer initial consults is that you really get a chance to hone in on an accurate diagnosis, which in the vestibular world is essentially the most important thing because it will then direct treatment. The treatment has to be exactly what is required for that particular condition, and those longer consults allow for that process to happen.
We use VestiCam goggles, which are goggles that are used for the assessment of different types of vertigo and vestibular conditions. So when someone suffers from vertigo, their eyes will have a nystagmus, and these goggles are able to pick up that eye movement without any distraction of room light. So that means that our diagnostics are a lot more accurate than someone not using the goggles. Having a dedicated vertigo and dizziness clinic means that we have the latest technology being able to assess and treat someone with vertigo. It also means that we are highly trained, and this is all we do. We only treat dizziness, we only treat vertigo. So we are experts in this field.
So the interactions that we would have with doctors and specialists as part of Dizzy Clinics Australia it's a really big important part for us. We need to make sure that we talk to the doctors, that we educate them on what we've done and why we've done it. We work a lot with the ENTs and all the surrounding areas, all the specialists in the field of anything dizzy. We need to work together as a team to ensure the best outcomes.
Being able to work with the ENTs and neurologists means that people are no longer having to wait 4 to 6 months on a wait list, and that means that they can get fixed quicker and get back on with their lives. I think it's really important to educate and empower our patients. I'm a big believer that knowledge is power, so if they understand what's wrong with them and why they're feeling the way they are, then they're much more likely to get better and feel better quicker. If you feel like you're suffering from vertigo or dizziness, contact us today or visit our website.